Well, good morning, everybody, and welcome to the Escape Hatch to Wellness. And today, my very, very special guest is Dee Harris. And with Dee, she is a registered and licensed dietitian and nutritionist, a certified diabetes educator, and one of the most important things for me personally is with the Institute of Functional Medicine. She's a certified practitioner, and she was also one of our teachers during the year-long program that I did to become a functional medicine certified health coach. And with Design Nutrition and Health Counseling that you have located as your business in Bonita Springs, I want to welcome you to this very, very special episode. And I'm thrilled to have the time with you to talk about food and nutrition, one of my favorite subjects in the whole world.
Thanks, Yvette. Hey, listen, it's my favorite subject too. I mean, I've devoted my life to it. so it's all good.
So when you said you devoted your whole life to it, when did your passion for diet and nutrition start?
Oh my gosh. I mean, I was a little kid. I was always into food. I was the one that had the stool up next to my mother in the kitchen cooking, and I'm one of 8 kids. So there was a lot of cooking going on. So yeah, I always loved watching her. I always loved to be in the kitchen. She always put on beautiful meals and made sure they were well-rounded with vegetables, and everything was homemade. And yeah, so I had a really good mentor with my mom. And I was just always into cooking, sewing, that kind of stuff. So it just made sense when I went to college. I actually was a home ec major. Mm-hmm. And so at that time it was food and nutrition or clothing and textiles. So I just found my passion with the food and nutrition, and I loved the science of it. And I loved, I just fell in love with physiology and biochemistry and that kind of stuff, believe it or not. But it just all kind of came together. So yeah, so I've been a nutritionist for a very long time. Yeah, I've worked in many different areas. I've worked in hospital kitchens. I've worked as a clinical dietitian, chief clinical dietitian. I worked for a food service company where I was the corporate dietitian. Then I worked in Connecticut. When I was up there, I worked for I actually started the meal planning for group homes. I actually put together a whole nutrition program for group. It was never regulated. And so I was one of the people who started all of that in Connecticut for group homes for the developmentally disabled. So that was fun. And then I went into long-term care for 21 years, and I worked with nursing homes. So I had a very diverse career in nutrition.
Well, when it comes time for being a dietitian and a nutritionist, what is the difference between the two, or are they just kind of one and the same?
No, they're not one and the same. It really depends on what state you're in, because it depends on the regulations and the licensure in the states. Some states don't have licensure, so you can hang up a shingle. So a registered dietitian is really going through the Academy of Nutrition.
Okay.
The American Academy of Nutrition. It's A&D, Nutrition and Dietetics. So that you have to complete their curriculum, which is you do the undergraduate, and then you do an internship, a master's degree program, an internship. Now they didn't require a master's degree when I was going through it, but now I think in 2022, they're all going to you have to have a master's degree. So that is, you have to complete that through the American Dietetic Association, which is now the A&D. And that's being a registered dietitian. Now, as a nutritionist, you can go different routes. You can do the master's program and then go through a clinical nutrition specialist program. Okay. The CNS program has just been recognized in the state of Florida for registration. So they can be a registered dietitian nutritionist in the state of Florida. Okay. Some states don't allow it. Some states do. And those people are really smart nutritionists. They're really good. They're very capable. But then in other states, there are people who could be like, I don't know, acupuncturists, chiropractors, whatever. And they do say they're nutritionists too. They're not licensed. They're not registered. In the state of Florida, you have to be licensed and registered.
I learned that in my training with functional medicine that each state is different, and Florida is
Mhm,
quite strict with it when it comes
mhm.
to for advertising. You are a nutritionist, or you're going to help someone with their diet and nutrition, and you have to have backup, a license to say that. You can't just move here and start up your own business, which is great. It really protects the people, though, right?
It does. It does. And I think what people don't understand is that a, a registered or licensed nutritionist in a state can actually do medical nutrition therapy. And it's medical nutrition therapy that actually is codable for insurance. If you have medical nutrition therapy, now I will say that it used to be a little bit more liberal with the, with the insurance companies. But now the insurance companies have really cracked down, and there's just not as many insurance companies paying for it, which is really a shame. Medicare will only pay for a couple of services, and that's for diabetes education and kidney disease.
Now, when you say medical nutrition therapy, can for someone who may be new to all of this technology and this verbiage, can you define what medical nutrition therapy is?
Well, it is a therapy where we actually can manipulate the outcomes of a disease state and do prevention also. But we can actually help a person to improve their health and change the course of a disease state. For example, let's say diabetes. If I have somebody coming in here with a hemoglobin A1C of 6.0, that is a pre-diabetic condition. We can reverse that with lifestyle and if they go into a physician's office, they're going to be given a medication. But I can do it with supplements. I can do it with a thing like berberine and alpha lipoic acid, and there's a bunch of stuff that clinically I can recommend to them, along with a very low carbohydrate diet, and making sure that they don't eat, sugar and high carbs and things like that, and adjusting their meal patterns where it's going to be optimal for them. So we actually can reverse the disease state.
That's amazing.
Can we get them off the diabetic, continuum? Probably not, because they're probably have, genetic predisposition to it. If they start gaining weight, they might have insulin resistance. But if we can keep their weight down, and we can keep their diet under control, and then watch what they're doing with supplementation. So here's another great example of this. As a nutritionist, I'm really looking at micronutrients. I look at macros too, but I'm looking at micros. And I'm seeing that there's so many people who are deficient in certain vitamins and minerals. And for example, chromium is extremely important in somebody who has insulin resistance. You have to have chromium to get that insulin and sugar into the cells. And so one of the things that we do is we just, we can do a micronutrient analysis test, or I just can say, okay, let's give you 200 milligrams of chromium 3 times a day, and let's see if it improves your blood sugar. In many cases, it does.
Wow, something so simple. Who would have even thought that? I mean, my dad was diagnosed with diabetes too many years ago, and he's been able to maintain that with just a diet, exercise, so that he didn't have to go into the level of diabetes 1 and insulin shots. And he was very relieved that just by minor weight loss, minor food adjustments, and just getting exercise. I mean, that's as simple as it was for him.
A lot of times we'll see patients who could do it just with, diet and exercise. But then there's those other ones that are just so stubborn, and you've got to get to the root cause. And it could be because of the fact that they're not absorbing vitamins or minerals the way they should. They need more of it because of genetic issues. It's just we've got to drill down, and that's basically what I do. I take the time to drill down, and that's medical nutrition therapy. I mean, what you're doing is like health coaching, where you can say, okay, we can change diet, we can change the macros, we can drop down and use a lower carbohydrate diet. You can help them with grocery shopping and stuff like that. But we're getting into the biochemistry of it. We're getting into the cellular level. And that's what medical nutrition therapy does.
Now, when you're talking about drilling down into the micros, was that something that came to you and your awareness when you made that shift into functional medicine? And is that where that all came in from?
Yeah, I mean, I was trained in it, but you don't use that even in long-term care. I mean, we do check labs and I look at things like, vitamin D levels and stuff like that. But the problem is conventional medicine, and especially when you're looking at long-term care, that's one of the reasons why I got out of long-term care, is because we saw patients with who were presenting with more depression and maybe anxiety or something like that. And I'd be sitting in these care team meetings with all the physical therapist and the nursing staff. And, we have these, you have to have these meetings every 3 months for each patient. So when you're reviewing the chart and sitting in on these meetings and you're hearing all these symptoms and you're saying, okay, somebody's now diagnosed with depression. And I pipe up and say, well, did you check their vitamin D level? And they look at me and say, we don't do that. And I'm like, well, what do you mean you don't do that? And they said, well, Medicare doesn't cover it. And I'm like, but Medicare is going to cover a psychiatrist to come in and give this elderly person, a SSRI or an antidepressant, whatever. And yet you won't pay for a vitamin D level. And vitamin D, we know, can cause depression. And you're talking about elderly people inside a home that don't get outside. They're not getting vitamin D. Their diet is so limited, and it's self-limiting. A lot of times they just don't eat that much, and the portion sizes are small. So bottom line is most of those people are vitamin D deficient, and they wouldn't pay for a vitamin D level because it wasn't covered under Medicare. I'm like, I am so out of here. Bye-bye. This is not, it just wasn't fulfilling. I couldn't help anybody. Mm-hmm. And that was my problem. When you go into healthcare, your whole goal is to help people, right? Your whole goal is to get people feeling better because you have the knowledge to help them. And when you're pulled back and say, oh no, that's not allowed, or no, we won't cover it, or we won't, I'm like, oh, come on, there's got to be a better way.
That's why it's called healthcare, not health. I don't care.
Well, really, and it's nobody's, well, it's not the doctor's fault. It's just the system. The system that we have in this country is it's for illness. It's not for wellness.
Yeah.
It's for illness. So a lot of times we're getting people who have been ill for a long time. Do you realize it takes like 5 to 10 years for a vitamin deficiency to actually turn up into an organ system failure?
5 to 10 years. That's incredible. No, I had no idea it was that.
Yeah. Yeah. I mean, some of it's shorter, but some of it's can take a long time. And that's why we do prevention. That's why I want to look at labs. I want to look and see what's going on. I look at genetics. I want to see if people can tolerate certain or can't tolerate what is in a normal multivitamin. Mm-hmm. Maybe they need a different form of a mineral or a vitamin, or especially a vitamin. So what we're looking at is personalized medicine. It's personalized nutrition. And that's what functional nutrition is. That's what functional medicine is. It's looking at the person as a whole. It's drilling down and figuring out what happened. When did they start not feeling good? Right. What was the trigger? And then going back to that and saying, okay, maybe this happened, maybe that happened. And it's amazing when you do genetics, you lay this whole thing out and you say, oh, no wonder. Mm-hmm. No wonder this happened to somebody. And it's eye-opening. And we can actually turn things around. We can actually make people feel better. And, especially when it comes to like neurotransmitters and people with depression and anxiety, and it's just a lot of it starts in the gut.
I like that you say that it's personalized care, because what I find personally is that when you go to treat someone, they might have diabetes. You have two people side by side that have the same condition, but it's their history that changes everything. So you may treat someone with this and then expect that this over here will be the same, and it's not, because we all have our thumbprint for a reason. So to, as you said, drill it down and personalize it to that extent really can help nurture someone back into health and vitality. And as you mentioned, from the root cause, which is the foundation of functional medicine, which is, really one of the reasons why I chose functional medicine to go into for health coaching, is because it is going to the root cause. It's going back in the history and really going to that root, that nugget, so to speak, that can be addressed from there, from the inside out, not just the outside in.
Mm-hmm. Yeah, and it's so personalized that what the normal physician is ordering on labs, it's not getting to it in many cases. So, I'll give you an example. We've had a real string of people after COVID. Well, not after, we're still in the middle of it. But, since the lockdowns and everything, we've had a string of people in. A lot of patients, we've had new patients, but we've also had patients who had been here, gotten better, haven't heard from them in 2 years. And all of a sudden, post lockdown, they're sick. They're back having symptoms of gastric issues and IBS and diarrhea and constipation and whatever. So we're getting them back in here and, again, drilling down and figuring out the stress and what stress does to digestion and absorption and all of this stuff. And it's just, and the anxiety of not knowing where we're going with this whole virus and political environment and God knows what all, that's going on right now. So we're getting a lot of people in that have a lot of stressful triggers, and it is affecting their total overall health.
People understand the depth of where stress goes to. And it's not just, we have stress, we have to have stress in the body. It's how our hearts, beat and our lungs work. But at the same time, it's the chronic stress. And with it's being sustained over not just a few days, but months and months, that's where everything is going to, go up. And that's why you're seeing so many patients in your office. But, it's something to go back to before we get into the pillars of wellness when it comes time for the functional medicine matrix. What I wanted to ask you is, what is the difference between what you do and what a traditional nutritionist dietitian does?
Oh, well, I was trained as a conventional dietitian. And I literally had to go back to school to become functional. It took me 5 years to get my certification. And it was because at the time you had to go to everything. It wasn't online. So, so it was a lot of traveling, and you had to go when it was offered. But there's a huge difference. Okay, so the conventional dietitian is really trained more to, you're trained to do food service. So you have to learn how to run a kitchen, like a hospital kitchen. So that's one piece of it, is the food service part. But also when you get into the clinical part really is more about following through on a physician's diet order. So if somebody has a cholesterol of 240 and they put them on a statin drug and they write the script, low fat, low cholesterol diet. Okay, so a dietitian takes that order, and that's the diet that she's going to do for them. And normally a regular dietitian does not get into supplementation, rarely gets into supplementation, unless the doctor orders like a vitamin D level and it comes out at 28, then the doctor usually writes the script for the vitamin D level, for the vitamin D. But normally a conventional dietitian does not get involved in supplementation. It's just diet orders. Okay. Now I have the highest respect for renal dietitians, kidney dietitians, the ones who are taking care of patients in dialysis units. Those dietitians are doing more of what I'm doing as far as looking at the labs very carefully, adjusting the diet as needed to low potassium, low phosphorus, low protein, that kind of stuff. They're constantly manipulating the diet for the patient on dialysis. It is a very specific field for a registered dietitian. But a conventional dietitian that is in a hospital setting, that's basically what they're doing. They're just basically filling the diet orders. So that's that. And in a hospital, again, you're only having a patient for a very, very short period of time. You're not following through for lifestyle and changes and stuff. You give a discharge diet and you never see them again. But with what I'm doing, or what most functional dietitians are doing, we spend a lot more time with the patient. We do that full timeline, as you know. We do the full timeline. We go way back. We even go back to, hey, were you breastfed?
Yeah.
We want to see what the microbiome, how it was developed over the course of years. We talk about, any medications, any illnesses that they've had from years back. I mean, we go way back. And then we look at the supplements that they're on, the medications that they're on. I actually have a subscription to a lab service where we plug the labs through a functional lab service, and it gives us an amazing analysis of functional analysis of what's going on with that patient. So that's a really good baseline for me, but it's awesome for the patient because they actually get to know what is an AST. What does that mean? So it's an educational tool because no physician has the time to review a lab line item by line item.
Yeah.
Whether, they're only going to say, oh, well, something's high, so we'll watch it, or let's write a script for it, right? Mm-hmm. So it's, we have very quick medical services in the conventional, but in functional, it's very long appointments. Mm-hmm. Because we need to really we get to know the patient. We get to know the patient inside and out, and we educate them on their issues, their conditions, what's happening in their bodies. They walk out knowing more about themselves physically. Mm-hmm. We spend, a lot of people spend time learning about their cars, right? But they don't learn about their bodies. So that's what we do. We open up the hood and we show them what's going on.
I heard someone say that they could ramble off, all these baseball statistics, all these, players in the basketball, football, they can do all this, but ask them about the human body, crickets, you get nothing. And it's really a shame because I'm very lucky. My mom. So my mom raised me to be very aware. I don't know at what age it was first introduced, and it certainly wasn't a word that was used in the household, but she and even my grandmothers, when I was a kid, my grandma, my dad's mom, taught me to eat the rainbow, and that was not even part of her language, but she said everything should be color coordinated, even the presentation on the plate, because if they're color coordinated, the foods will work together because it helps prepare the palate, et cetera, et cetera. And that was from literally since I was 2. I mean, I remember this, that's how deep of an impression it left on me. So with that kind of awareness, when I would go to eat somewhere, or, how I go to eat is really part of a consciousness that I was raised with. I'm so grateful for it because I understand it and it makes a lot of sense. And when you work from that kind of awareness, it's kind of shocking sometimes when someone's like, oh, well, my plate's all white. And you're like, all white? No, bring some color in there. It's the most basic nutritional aspect.
Fries and bread. Yeah, you were blessed. You were blessed to have the knowledge and the importance of nourishing your body, because it's not just filling the tank. Mm-mm. A lot of people feel like, okay, I can pull through McDonald's or Burger King and I'm hungry, I'll fill the tank. No. It's not about that. It's about maintaining good health. You're only as, we heard the saying, you are what you eat, right? So you're ill if you're eating sick foods. So it's just really important to get the knowledge out. And that's why health coaches like you are really important, because any way we can get the knowledge out to eat a rainbow and the importance of those type of foods and things like that. But then I'm looking at the genetics and saying, oh, you've got a variant in this gene and that gene, and you don't have good detoxification genes. So here's the workaround. We're going to eat broccoli and Brussels sprouts and cauliflower. And so I'm giving the why because I'm seeing it on a lab. But I wanted to just circle back a little bit because, as I said, a lot of people are coming in with all these stressful things, and we were talking about that it takes so long for illnesses to show up. One of the things that I'm finding, because we're doing a really specific stool analysis, it's called GI map testing, and it is we're having a lot of our patients do this. Anybody with a gastric issue, we're making sure that they do this. But what I'm finding of it is that we're seeing more and more patients with H. pylori, which is an infection in the stomach. And
Again,
Helicobacter pylori, it's an infection that can grow and when it overgrows in the stomach, it wreaks havoc on digestion and absorption. And we even see patients with osteoporosis, and you're like, I take calcium, I take vitamin D, why are my bones falling apart? Well, it's because they're not absorbing it because of the H. pylori.
wow.
People could have this condition for years and never be diagnosed. I have patients who said, new patients who come in and say, I've had gastric issues for 15 years. I'm like, whoa. And they just, take over the counter stuff because they're doing symptom relief and they're not getting to the root cause. And it's another example of why it's important to do functional medicine, because you need to get to the root cause. Otherwise, the cascade of illnesses that happen, especially when it comes to digestion, the cascade of illnesses that happen are just mind-boggling. And why suffer for so many years? I had one guy who said, I have been to every gastroenterologist in the area. I have been scoped this way and that way. I've done all this stuff, and I'm getting worse. I'm getting more, I'm like getting more allergic to foods. I can't tolerate foods. And I'm like, okay, let's figure this out. We did this test, and sure enough, the guy had a raging infection of H. pylori.
How do you get H. pylori in the first place?
Well, we have the bacteria growing anyway, but when it overgrows, that's the problem, number one. Number two, you can get it from another person. So whenever you have somebody in a family that has it, we have to test the family.
Oh, wow.
Because they could be getting it from the whole family, from somebody else in the family. So I've had multiple patients like this who've been sick for a very long time. And once we try to heal the gut and we get rid of the infection, all of a sudden it's like we gave their life back. But again, it's getting to the root cause. And I've actually written recommendations that they go back to their doctor. You can do a breath test for it, but this test that we're using, the stool specimen test, is really amazing because it's telling us a lot if they don't have enough enzymes to break down their food, if they don't have enough bile to break down their fats, if they have a low secretory IgA, which is a marker for the immune system in the gut. And if they don't have enough of that, that's like, okay, you can't fight anything if you've got a low secretory IgA in the gut. So this is a perfect example of drilling down and finding the root cause and then treating.
Well, can you give a couple of details when it comes time for having gastro issues? And you said that somebody had them for 15 years. Can you just give a quick rundown of what kind of symptoms they would be experiencing that would be, okay, well, this is not normal. Let's switch to a functional medicine perspective and go to.
I think the most common is constipation. Because I've had people in here who said, my mother said I was constipated as a baby.
Oh, wow.
Yeah. And they've been on laxatives. They're doing, prunes. They're doing all kinds of stuff. So they're doing symptom relief to try to get rid of the constipation, but they're never getting down to the root cause. Mm-hmm. So the root cause could be that they have an imbalance of bacteria growing in the colon. Mm-hmm. And we need to fix that. And you can't just do it with just a general probiotic over the counter. Mm-hmm. We have to figure out why is this happening? So again, if somebody has got H. pylori, that can happen. If somebody's got SIBO, that's another gastric issue that we're seeing. We're seeing a lot more SIBO. So SIBO is a small intestinal bacterial overgrowth. You're not supposed to have a lot of bacteria growing in the small intestine. You're just not. It's supposed to be growing in the large intestine. But if you have low stomach acid, if we go down the cascade, digestion starts in the mouth. You've got to start chewing.
Yeah.
Okay, you chew your food, it goes down to the stomach. You're supposed to have stomach acid to churn it and to break it down. But it's that stomach acid that's actually triggering enzymes out of the pancreas and bile out of the gallbladder. So if you don't have enough stomach acid, you're not going to have that trigger, a good trigger. And so now you've got food going into the small intestine that can't be broken down real well because you don't have enough enzymes and bile. But what happens is with low stomach acid, it also changes the pH in the small intestine. So the small intestine is supposed to be a little bit more acidic. First of all, the stomach's supposed to be the most acidic. Then the small intestine is supposed to be a little bit more acidic. Then the colon. The colon is the least acidic. It's alkaline. And that's where most of our bacteria live. However, if the small intestine becomes more alkaline, it becomes an invitation for a new neighborhood for the bacteria to grow in. And especially if the food isn't broken down enough, then now the food is there for the bacteria to live on. And so one of the first symptoms that we see with that, we might see some constipation and/or diarrhea, but more importantly, it's that bloating 2 to 4 hours after eating. That's classic.
Mm-hmm.
If somebody's really bloated 2 to 4 hours after eating, and if they eat certain foods that have fibers in them, like apples and pears and artichokes and avocados and those type of things, and they get really bloated after that, or even something with lactose in it. There's many people think that, oh, I'll just drink lactated milk.
No.
So, but anyway, they land up having this very, very bloated feeling right after. Now, SIBO is really hard to get rid of, and it's least diagnosed by a gastroenterologist.
Really?
They call it IBS.
Oh, that's the equivalent. I wonder. I've heard both terms used, and SIBO has become more popular. And actually, I'm thinking about during my training, we heard the SIBO references, not, I would say more often, but yet more powerfully positioned than IBS. I mean, kind of, we obviously gut is talked about a lot during functional medicine.
Right.
Training. I mean, I think it comes up literally, if you're not sleeping, you're talking about your stomach. So it's kind of along those terms of how important it is in the world. And I don't think people understand the impact that our gut has on our entire system.
It's just mind-boggling. But with SIBO, yeah, it used to be IBS, and a lot of doctors are still naming it as IBS. I'm sending patients back to their doctors and saying, please do a 3-hour breath test, because a 3-hour SIBO breath test is going to show where it's at. I mean, if you do a 2-hour, that's going to hit the upper intestine. It doesn't hit the lower intestine. I had a patient come in yesterday who had a report of a 2-hour breath test, and she still has symptoms. She said, and on the bottom of the report, it said from the gastro guy, it said no sign of SIBO. And I'm like, yeah, you've got signs of SIBO. You've got symptoms. So it's like, you have to test the right way.
Yeah.
So I'm still treating her. We're dipping her big toe into the water of starting to introduce new foods that were on the FODMAP diet. But she's keeping a really strict diary to see if she's getting bloated again. Because SIBO can come back. These spores, these bacterial spores, will, even if you kill it with an antibiotic or an antimicrobial, if you only do it for a short time, guaranteed it's going to come back.
Wow.
It's very, very hard to get rid of.
Wow.
It's very hard to get rid of, and that gas and bloating is nasty. And again, it can cause constipation and/or diarrhea, but a lot of times I'll see it with constipation.
So someone who has maybe quote unquote a gluten allergy, excuse me, a gluten allergy, it could actually be SIBO and not really just the gluten allergy, or would it be a combination of the two?
Well, when you have SIBO, you have bacteria growing in that small intestine. The bacteria actually can wear away the lining of the small intestine. And the lining of the small intestine is only one cell layer deep. It's really, really thin. So when you have breaches in that, those tight junctures that are when you think of think of a dam, okay? So when you're absorbing your food, once it's broken down, it opens and then it closes. It opens and then it closes. That's supposed to be like that. And then the food drops through and then gets into the lymph system and then gets transported. So that's how we absorb our food. But if the dam is always open, and the food is not being digested well, then it actually can go into the lymph system in larger portions or molecules. The other thing that can get transported is the bacteria. And some of the bacteria is creating toxins. And some of those toxins can cause autoimmune diseases such as joint pain. Klebsiella is one, can do all kinds of issues. So we really want to tighten up those junctures and clean up the gut. And that's, we want to get rid of SIBO. So you get rid of the pathogens, you tighten up those junctures by doing a gut healing protocol. You put them on a food elimination diet. So gluten is the one thing that we take out whenever we're doing a gut protocol. I don't care if you're gluten intolerant or not. We're taking you off gluten while you're going through the healing process, because gluten stimulates a chemical called zonulin to be released. Zonulin is the thing that keeps it open. So we don't want it open. We want to try to heal those junctures. So that's why we get people off gluten during a gut healing protocol. Once they're healed in 3 months, we can do a food sensitivity test. We can do there's a really great test that's done by Vibrant Labs now. It's called the Wheat Zoomer. Have you ever heard of it?
No, haven't.
Yeah. Okay. So it's by a company called Vibrant Labs. Also, Cyrex is the other one that's been known. So there's there's like 30 different things in gluten, in bread and wheat and anything that has gluten. So there's like 30 different things that your body can react to. So when a doctor just orders a gluten sensitivity test, it's usually only 2 to 3 things that they're testing, maybe only 1. They might just be doing a tissue transglutaminase, there's 30 different things that you could be reacting to. So there is a thing called this Wheat Zoomer, which is by Vibrant Labs, which you could just do that lab test if you really want to see if you're sensitive to gluten. I tell people, there's no redeeming factors when it comes to gluten. And if you've got gut issues, it's better to be off of it. And a lot of times instead of spending money on a test, people don't want to spend money on lots of tests. So we kind of have to prioritize the tests, and maybe we don't do the sensitivity test for gluten, but we get them off of it anyway and see how they feel. And I have one young girl who's been sick since she was a baby. She's 20 years old, 18 years old now. And she has had gut issues since she was a baby. I was talking to her mom, and it got so bad, she finally came to me, and I said, hey, listen, honey, let's get you off of gluten and dairy and see how you do. All of her symptoms went away.
Wow.
With the
Every
gluten.
symptom went away with taking just
all symptoms went, all the bloating, all the gas, all the diarrhea / constipation. She's having normal bowel movements. Everything cleared up in a month when we got her off gluten. So we never tested her.
You didn't have to, obviously.
Didn't have to. So, and they tell you in IFM that the gold standard is an elimination diet. You start with that. You don't always start with the food sensitivity and allergy testing. Although if somebody has difficulty doing an elimination diet, and I have people who are show me people, I want to be shown.
Prove it.
You have to prove it. Those are the people that we say, okay, you're not getting better because they can't stay on the elimination diet. So let's actually test and find out what foods we actually have to take out.
Right.
So that, and you have to work with the patient. You've got to meet them where they're at. You can't, there's no formula to this. It's like
No, there isn't. It's the same, in a lighter comparison is even with meditation, you still have to meet people where they're at. And, teaching at the hospital, you have all kinds of people who come in with different expectations. And I had someone yesterday who approached me because she wants to use meditation to help her in her mindset for losing weight. And so she said, can I work with you one-on-one? And I said, absolutely, because we can cultivate a specific intention. So as you do the body, you are releasing the blocks that are holding you. You'll still have to go onto an elimination diet and try and figure out what it is you have food allergies with. But, it's part of your mindset, because if you can do this, you can do anything. So the mindset with the elimination diet, like with the patients or clients who say, okay, come on, Dee, show me. And then they go to try it and they can't do it because they just don't have, the self-regulation in order to move through it, because they have the addictions to the Twinkies and the cupcakes and the nuts and the glass of milk before bed. I mean, there's so many layers to it.
Yeah.
And we're so conditioned by society. That's just the bottom line.
Yeah. Yeah. And I think that's where you have to do a lot of education and show people why those choices are not good for their bodies and what they're actually doing to their body, as far as the toxic exposure, as far as the sugar load, what it's doing to their neurotransmitters. You could go on and on and on, but you just break it up into pieces based on whatever they're presenting with. And all of a sudden you're giving them the why to do it.
Yeah.
Because once they have the education, it's like, oh, I mean, I had a guy in here yesterday who said he drinks rum and Coke. I'm like, whoa. So, I mean, he enjoys rum and Coke. And I said, okay, let's find something else that you can enjoy without putting Coke in it, because he was running a little high on insulin. There were things that were pointing in a not great direction, and he's starting to gain weight. And so trying to figure out what else we can do. So we work with them on the why, number one, and to show him what was in. Hey, listen, your mother died of cancer, and this has a chemical in it that you might want to consider, or take out of your diet because of your history. So those you just have to hang on to what they're telling you, and then circle back and use that as part of the educational tool.
Going through the program and learning the five, I call them 5 pillars of wellness, is part of what supports the wellness of the overall body, with stress, sleep, nutrition, fitness, and relationships. Those are really the 5 areas. And one cannot operate without the other, because you have to have, obviously, proper nutrition to be able to sleep well. And nutrition can also affect your stress. So can you talk a little bit about how nutrition affects the other areas of sleep, stress?
Sure. Well, first of all, as I said, every single function in your body depends on a nutrient. And there are nutrients that are absolutely so important in creating neurotransmitters. So protein is necessary in creating your neurotransmitters, but you also need micronutrients for it. So just take, for example, sleep. You need melatonin to go to sleep. It's a hormone, but you need melatonin. And melatonin is made from serotonin and GABA. So you need to put the brakes on at night. So you're going all day long. Serotonin, 90% of it is made in your gut. So if you don't have good gut function, you might be low in serotonin. Also, I'm finding a lot of people who are on antidepressants, they're depleting their serotonin. So, which is really interesting. So they're having sleep issues, and then they're put on a sleep med. So now you're just adding more medications for things that are, let's get to the root cause. But you have to, and then when you look at sleep, I'll take sleep because you use that as an example. When you look at sleep, sleep is important in detoxification. Your body does more work in the middle of the night than it does during the day because you've got to detox in the middle of the night. And you need all kinds of stuff to detox. That phase 1, phase 2 detoxification in the liver, you need B vitamins, you need magnesium, you need a thing called glutathione, which your body's supposed to make. You need protein, you need cruciferous vegetables, there's so many things you need for phase 1 and phase 2 detoxification. So if you're not nutrient repleted, or you have a good nutrient status, then now your detoxification pathways are not good. Mm-hmm. And so those toxins start building back up in your body, and that's what causes the free radicals, which causes illness and cancer and on and on and on. So you have to look at how nutrition is affecting that aspect. So when I look at sleep, I'm thinking, okay, getting to sleep, going to sleep, and then lowering that toxic burden in the middle of the night. Mm-hmm. So when I think of nutrients, I think of all the nutrients involved in all of that. Then if you go to stress is really, oh my gosh. So stress, even if you have 3 days of chronic stress, and I think of somebody who's gone through a loss, a really dramatic loss, and you're just so stressed out. In 3 days, you can change your microbiome. In 3 days, your microbiome changes from maybe a healthy microbiome to not so healthy. There are microbiome bacteria that are creating certain vitamins, like vitamin K2, B12, it's involved in B12, it's on and on. So stress can change the microbiome, number 1. Number 2, stress changes your whole digestion. If you notice, if you get really stressed, some people get really stressed, they'll end up having a nauseous stomach and diarrhea. Okay, it all starts with this adrenal brain connection, the hypothalamus, the pituitary, and the adrenal glands. So that's called the HPA axis. So it is really strong, that gut brain connection. But what it really does, one of the things that we know it does, is it shuts down the vagal nerve. That's why your meditation and your deep belly breathing is so important. So what happens is you've got this vagal nerve that is starting from the brainstem and it goes all the way down. It works on all your involuntary things you don't even think about. It's like from swallowing to opening and closing all those little sphincters between the esophagus and the stomach and the small intestine and the small intestine and the large intestine. It's involved in the motility going through the intestinal tract. It's involved in letting go of the stomach acid for digestion. So really, when I said it starts in the mouth, your digestion starts in the brain, because it's the cephalic phase. When you start smelling food, you start salivating, you're also starting to create stomach acid to help prepare for digestion. If you're under a lot of stress, that shuts down. So it's like you're eating food not ready to digest it. Mm-hmm. And that's where you're not having enough stomach acid, so you can't absorb B12, you can't absorb minerals. When I see people under chronic stress, no wonder women are having osteoporosis. Mm-hmm. You're not absorbing, even if you're taking calcium supplementation and bone supplementation, if you're under chronic stress and you don't get that gut straightened out, you're still going to have that issue. Mm-hmm. So stress is just, one I'm telling people is do deep belly breathing before eating. Yeah, 4 to 7 rounds of that deep belly breathing. And, I don't know about you, but I grew up in a big Catholic family, and we sat around the table. There were, 10 of us around the table, and my father would stop and pray. Mm-hmm. And we would pray before eating. We would pray after eating, but it was slow, and the rest of us are kind of rolling. Yeah. But he was preparing us for digestion. because we had our plates already full in front of us. And I'm like, okay. But that is, so praying before eating, intentional praying before eating, and deep belly breathing is going to prepare you for digestion. It's cheap. You don't have to buy a pill.
In teaching people, because I was teaching breath work at the pulmonary rehab center. So these are people obviously who had, issues in the hospital. And then even with teaching at the wellness center, the amount of people who don't breathe properly is shocking to me at times. And I can tell because I don't see their bellies moving. Even when I'm saying, let's do the relaxation breath is what I call it in meditation. But it is a 3-part inhalation, which is the belly rises, the chest expands, and you finish at the throat. And then you exhale from the throat, the chest constricts, and then you pull the navel point back towards the spine, and you are actually massaging, you're using your diaphragm, and you begin, it actually helps with your digestion. And you don't have to do it for very long, but I always tell the women in my class, because most women have the struggle with it the most, because men, they don't care about their waistlines, their bellies hang over their belt buckles and whatnot. But women have the greatest challenge with it because it's not natural, because most women tend to breathe from the upper lung and up in this part of the lung. And I believe it's because, for decades, women wore corsets and pantyhose and were very body conscious, and we don't want to be seen as being fat. And by breathing from the belly, we could look.
You're expanding, yeah.
Yeah, you're expanding. You're going past your size 2, and you've now become a size 4. But you know what? It's totally okay because you're helping your body in ways you can't imagine. But Dee, I can't tell you, it's still, I really try and practice non-judgment, but it's really sad. I find it very sad that people just don't know how to breathe properly. And it's a minor thing. As you said, it's free. It doesn't cost you anything to breathe.
Yeah, and if we can use tools. There's lots of apps on your phone. You can use tools to get people to do it. And even if they're sitting at a red light and they're ready to explode, that's the time to teach them to use this technique, is when they're in a situation that they can feel their blood pressure rising. And that's one of the side effects of stress, right? Is to, and we've shown it that deep belly breathing absolutely lowers your blood pressure. So anybody with white coat syndrome that goes into a doctor's office and traditionally gets their blood pressure taken and it's always high, I tell patients, before you go in, or if you're sitting in the waiting room, do rounds of deep belly breathing, 5 minutes of deep belly breathing. Then you go in, your blood pressure will be normal. Well, depending on where your baseline is, it will be lower than it would have been.
Yep.
Especially the people with white coat syndrome. It's just because they're so nervous, they're stressed out about going to the doctor. So it's affecting their blood pressure. It's that hypothalamus, that HPA axis, and it's a chemical is being released from the pituitary that's raising the blood pressure. So just lowering the blood pressure and getting them to breathe. The other thing that's interesting is you can stimulate the vagal nerve by gargling with water.
Oh, that's awesome. I didn't know that part. That's awesome.
So yeah, there was a physician, Dr. Datis Karazian, came out with that one, and it's been a game changer for many people. We have them gargle with water until they tear, because there's a little tear duct that in the back of the head that goes to the eye. It's like a nerve that goes to the eye, and when you stimulate the vagal nerve, it vibrates this little nerve, and that's when you're stimulating the vagal nerve, is when you're gargling and you start to tear. But the vagal nerve is really important to stimulate, because this is a main nerve, and it's going to help. I mean, we've gotten rid of people with constipation, because we're starting to now move that nerve by just gargling 4 times a day and stimulating again, it's free.
The human body is
Amazing.
just amazing. I mean, what was created is can't be duplicated. It really can't. You cannot reinvent this. Just a phenomenon. Well, I know we're kind of coming to the end of our session, and I have so enjoyed this. If you would love to come back, I would love to have you come back, because we haven't even talked about the immune system and
Oh yeah, I know. But we wanted to talk about sleep and stress too. But there's so much more on stress, but those are just some tips. Um, but just to decrease the stress is so important because it's going to affect everything from digestion to your nutrient status to your, and I think if you look at that bottom of that um, matrix and those 5 pillars, as I said to you once before, I think the stress is the biggest killer. It will ruin everything all the way across because it affects relationships too.
Breaks down the relationship even that you have with yourself, because you self-induce, additional stress. You have your outside stressors, obviously, but what your mind does with it is compound.
Yeah, exactly. Well, I don't know if you can hear it, but I apologize for the landscaping crew outside my window.
I wonder what that was. But as we wrap up, I have one question for you, which is, you're located obviously in Medina Springs, Florida. So if someone who is watching this is located, let's say, in Massachusetts or Rhode Island, can they still take advantage of your services from a long distance?
Yeah, we have an electronic medical record that has a Zoom embedded in it, so that everything is HIPAA compliant. And especially with COVID, they've really relaxed the rules about having going across state lines for doing counseling. So yeah, we have people all over the country.
Okay. All right. Well, I will include your information here at the bottom of this, down here.
Great.
The bottom of the frame. So I have your, whatever you have in Natural Awakenings magazine. I will actually hold the magazine to see if I can do a little promo for, it's backwards. But
Yeah. It's the only place I advertise.
so I will include you have in that ad beneath the video itself, but I'll also include your contact information as a bar across the bottom. So anyway,
Thank you, Yvette. I appreciate it.
oh, thank you. I really appreciate your time, and thank you for even your time in training us as functional medicine health coaches, because it's a vital ingredient and a really important part of our aging process, and the quality of our lives is our nutrition. And I thank you for the deep dive that you did with me today. I really appreciate it.
Oh, it's my pleasure. Happy to do it, and glad to see you're supporting all of us in functional medicine with the health coaching too.
Any way possible for people to that having quality of life is so important. And having worked in a vacation environment for most of my career and watching people who didn't always have the capacity to enjoy their lives in the present moment really has been what my driving force over the years, and what has kept me wanting to do more for people to help them understand and be aware of their things to have a better life.
Well, you're in a great place. So good luck to you.
Thank you. And to have access to someone like you, not just up the road, I really, really appreciate so much. And thank you a lot. So have a great day, Dee.
You too. Take care of it. And thanks again for the opportunity.
Bye for now.
Okay. Bye-bye.